some questions.
Governor, could you are you deploying National Guard troops in Richmond? I mean, can you clarify that just a little bit more? And then, are there any guesstimations on crowd size at this point, or exactly what threat people should be looking out for?
The first part of your question, the Virginia National Guard will be available here in Richmond. And as far as numbers, I don't have any exact numbers. I've just heard the intelligence that a lot of others have heard, that that all 50 capitals in this country are potentially under attack this weekend and during inauguration. So we take those seriously, and as you see, we're going to be prepared.
Tracy Agnew, Suffolk News Herald.
Thank you. Regarding the vaccine effort, there's a lot of anecdotal stories going around about people in 1A who haven't received a vaccine yet, while people in 1B or maybe even 1C who live in the same area have received it. So recognizing that it's important to get shots in arms, but we also want to get to the most vulnerable people first, how are you working to further prioritize the vaccination process? Yeah,
the question is individuals that are in 1A, and just to clarify that, 1A are our frontline healthcare workers in our emergency rooms, our ICUs, et cetera. And then also individuals in our long-term nursing home facilities, long-term care facilities, both staff and residents. So we're doing it in parallel, the answer to your question. Initially we were going to do phase 1A, and then when we saw that that was near complete, moved to phase 1B. But we realized, and we've made some modifications, and so 1B was, we went into 1B actually on Monday in 11 of our health districts, and that is expanding as we speak, and we've even made further modifications now. We initially in 1B, it was age 75 and up. Now we've changed that to 65. So as we receive doses from our pharmaceuticals, and as we put those doses into arms, we will continue to modify. The point I made last week, and one of the reasons why we set these goals, we brought in Dr. Avola, we've activated the National Guard, we've created a policy of either use it or lose it. The reason we did that is because at the end of each week, we don't want any doses in Virginia to have not been used. So we're modifying our plan as we move forward to be able to accept the doses that are sent to us and to be able to put those, give them to individuals across Virginia as expeditiously and safely as we can.
A couple questions. I know that you spoke with hospitals and local health systems this morning.
Yes.
And when you look at the CDC, Virginia is still ranked low when it comes to actually getting those shots in arms. So I was wondering if you could speak to that, and if there's any indication of what's causing that bottleneck, and that'll be my first one.
How many questions do you get today?
Just two.
No, I think it's a good question. And, I would start, Kate, by saying this is probably one of the most massive logistical efforts that has ever taken place in Virginia to when you think about it, to get 8.5 million Virginians, not one dose, but two doses. And so, I'm pleased with the way that we've rolled it. We've been in this for 4 weeks now. Obviously, we'd like to do it faster, and we've made the modifications that I've outlined, and we'll continue to follow those. We'll follow Dr. Avula's lead. He's done a tremendous job, and we'll continue. I think if you look at the 7-day running average of number of doses per day to Virginians, you'll see that it's going up each day, and we're going to meet our goal just as soon as we can. That first goal being 25,000 and then 50,000, and again by hopefully early to midsummer, all Virginians that are willing to accept the vaccination will be vaccinated. Well, I'm going to give you 3 more questions today. No.
I'll only take one. And the second is just, I'm wondering if you have considered putting in place new restrictions statewide when it comes to mitigating the spread of COVID, especially when it comes to emphasizing that schools reopen. We're still seeing wide community spread. I know the Hospital Association had asked for new restrictions. So I'm wondering, if we can expect those, and if not, why?
Well, a short answer to your question, all options are on the table. And I have been in close communication with a lot of people across Virginia, as has our staff, but particularly the Hospital Association. I have another meeting this afternoon scheduled with them. We'll be discussing the vaccination rollout and also their capacity. That's really important as we move forward, to know how many ICU beds they have, how many ventilators are in use, how they're doing with their staffing. So that's almost a daily communication we have. And for the most part, we're stable right now. If you look at our numbers today, we had just over 5,000 new cases, 33,000 additional tests, 74 additional deaths. So we follow this very closely. We've put some, I think very stringent restrictions in place, taking measures to mitigate those numbers. You know what those are: the wearing of this mask, both indoors and outdoors, the closing of restaurants and bars at 10 o'clock, a curfew after midnight. So the main thing, and I'll take this opportunity to reiterate it, this pandemic is in the hands of Virginians. We know what works. We know what's driving the numbers. We know that when people gather, for example, in their places of residence, and people are coming from different homes and different scenarios, that's what's driving the number. Places of worship. We're encouraging all of these individuals to follow those guidelines. We know that those work, and so that's a long-winded answer to your question, but the bottom line is all options are on the table. I look at that every day, and if and when we need to take other measures, we will.
Bill Atkinson, Progress Index.
Yes, thank you very much. Governor, the biggest issue we're hearing down here in Pittsburgh, out the rest of the Greater Health District, that the pace down here is a little bit slower than some of the other locations, especially because, in fact, we hospitals and all down here serve so many communities of color. What is the state going to be doing in the next days or weeks to possibly ramp up the speed for communities of color that have been served to get their vaccines?
Yes, I'm going to let Dr. Avula address that. Danny, thanks.
I think I heard the question which is that in some parts of the states we're having difficulty getting vaccine out. How do we make sure we prioritize getting vaccine to communities of color? Is that right? Okay. We definitely recognize that, as the governor said, this hasn't gone as smoothly as we could have hoped. I mean, but it is moving forward. And when you look at that epi curve of the number of doses that are given each day, the fact that our 7-day average is almost 12,000 doses a day, we are heading the right direction. We do recognize that there are certain parts of our state that need more resources. And so part of my role is helping connect the local health districts and the health systems in different parts of the state, making sure that when we know how much vaccine is allocated to certain hospitals and certain health districts, that they're making a coordinated plan to get after initially those 1A, because the particular part of the state that you have referenced is still in 1A, and that we can get them to 1B as quickly as possible. So, your specific question about how do we address this in communities of color, right now with 1A healthcare workers and long-term care facility staff and residents, that we recognize that those are the highest risk individuals, and we are doing everything we can to prioritize them. In communities that have moved to 1B, there will be the targeted groups, for example, teachers and people who work in factories and in food service, that will skew to minority populations in many of our communities, and so they are being prioritized. Concurrently, there are efforts to engage and communicate with the African American community in particular, but also other minority communities, knowing that there may be other reasons for vaccine hesitancy. Wayne Turnage did a phenomenal job of kind of breaking that down and talking about his own experience and the the history behind why the African American community may be resistant. And I think Dr. Underwood and her team put together a great event last week with Dr. Fauci, Facts and Fiction, really talking about why we need to increase uptake of a vaccine in the minority communities. So I think there's a lot of concurrent work, both in making access to vaccine more available as we work through the tier groups, but also in communicating the importance and the need for uptake in the African American community.
Thank you, Dan.
Hi, Governor. I'm with WSLS in Roanoke. My question is about your school's guidance.
Yes.
So why is now the right time to start talking about planning to get kids back in the classroom? We've seen low transmission rates because of measures they're taking, like social distancing, staying in the classroom, lower numbers of kids in the classroom. So what happens when those kids come back and some of those preventative measures aren't possible? And then my second part is about timing. So when is it a realistic timeline to get schools back open when we're still trying to vaccinate teachers and schools are likely going to need a lot of supplies stocked up to make that happen?
James, Dr. Lane is with us today. You know, just while he's coming up to the podium, a couple things I think to make clear to Virginians is our schools are safe. We know that we can follow the mitigation measures. The children have been very good about wearing their masks, the teachers, the staff, with spacing of the children, keeping their distancing, cleansing, all that's gone well. So if you look at the data, schools are very safe. It's the communities that we worry about. And so when the numbers are, you know, high in our communities, it makes us reluctant to move forward. But the overall message here is that, you know, we're getting individuals vaccinated. We expect if people continue to follow the guidelines that our numbers will start coming down. And so we really want to prepare and get families ready, get teachers ready, all of the above to move forward and get our children back in school. The last thing I'll say, and I don't mean to be stealing all of Dr. Lane's thunder, and by the way, I appreciate all that you all have been doing in the Department of Education. But you know, children are hurting right now. Families are hurting, and we hear it every day. Testing results are going down. So whether it be to get our children back in school as soon as we can, or modifying the summer months to add more days to the school calendar, which is something that we're seriously looking at, we all need to collectively get our children back in school, and that's where they need to be for a lot of different reasons. And so we've put a lot of effort in that. Dr. Lane?
Thank you, Governor, and thank you for the question. I believe the question was, you know, why is this guidance coming out now in the context of, you know, potentially some surges? And the intent of this guidance is to give school divisions the opportunity to prepare for the coming weeks. The guidance does a couple things. It first takes the CDC indicators everyone should be well familiar with and make sure that they consider community transmission. But it also adds an assessment of a school's ability to mitigate the impact to the actual school building, and it also requires schools to look at their community needs. And then when you see the guidance that will be posted here in about 10 minutes, you'll see that there's a matrix to help them make decisions there. And what we know is that we've been able to open many of our schools in the Commonwealth quite safely. There have been few outbreaks in schools, and even when there were outbreaks, in most cases, there were less than 5 total cases inside those outbreaks. And so if you follow the mitigation strategies that we outline in the guidance, if there's low impact to the actual school community, even in the context of moderate transmission in the broader community, we know that we can open schools safely. You asked a question also about vaccinations, and vaccination is a huge part of the strategy for getting our schools open. But our guidance does not make vaccination a precursor to opening if you can do the safety strategies that are in place. And so we know many of our schools have done this safely. We have many schools that are making plans now, and we wanted to put this out now. So, you know, we don't anticipate that new schools will start opening tomorrow on this guidance, but here in the coming weeks, we expect our school boards to look at this and make decisions based on a much more clear matrix around how to do this decision-making.
Thanks, Dr. Lane.
Governor, can you or Secretary Hopkins talk a little bit more about the capacity of the National Guard to handle these various assignments? How many are you having on standby in Richmond? Is it cutting into their availability for the coronavirus support services? Do you have concerns about burnout or about their ability to absorb the stress of these multiple deployments?
While Secretary Hopkins is making his way to the podium, a point that I would make, Greg, and I think you alluded to this with your question, is that the Guard has been very busy this past year, and whether it be natural disasters with storms, flooding, snowstorms, protests, testing, now vaccinations, and what I regret, but I am pleased to be able to offer the services of our National Guard. I regret that we have over 2,000 of them in Washington, D.C. right now, protecting our nation's capital from Americans. That should bother everybody. It should bother everybody when you walk out this building and see boards across the windows of our state capitol. So the point I'm making is that these men and women of our National Guard, men and women of all these police units that are doing such heroic work, there are a lot of other things that they could and should be doing right now. And one of those things for our Guard is to help with the distribution of vaccinations. So I am hopeful that peace will remain in our nation's capital and here in Richmond, and that we can get them back into Virginia as soon as we can so that they can carry out these other missions. Secretary Hopkins.
Thank you, Greg, for the question. I think your question was in three parts, actually. Capacity, and I believe burnout, and I think the governor addressed the sort of the resilience issue. Let me talk about capacity briefly. Whenever we get a mission for the National Guard, we make sure that we have the necessary resources to staff that mission. And so our work in the district, we're able to staff that separately from the security for the Capitol here, which is also a separate mission from what we do with the vaccine distribution or the testing program. And so there's a lot of logistical planning that goes into any of these activities, but prior to putting the Guard forward on a mission, we make sure that we have the resources in place to address it. So the short answer is, yes, we have the capacity to carry out every mission we've done. Now, that does not mean that we're not, as the governor indicated, asking the Guard to do a lot. But we try to make sure that we put the resources in place before we commit them so they can carry out these respective missions. With respect to burnout, and I touched on this a little bit earlier in my remarks, we have an incredibly resilient force, a group of over 8,500 men and women who really love public service and service to this nation. And our commanders and our leaders do everything they can to make sure that they take care of the needs of our Guard members, not just equipment and the resources, but also their health care needs, their emotional needs, et cetera, making sure that they're able to spend appropriate time with family. We work into the scheduled downtime and other ways to make sure that we're taking care of the members of the force. We make sure that we provide the necessary meals, the necessary lodging, and other resources to take care of them as well. So they're an incredibly resilient group. They're an incredibly proud group, a group that loves to serve the Commonwealth and this nation. And so we're always looking out for things that could lead to burnout, but we do take the necessary steps to try to keep that from happening as much as possible. And did I address each of your questions? All right, thank you.
Thank you, Carla. Andre.
Governor, for those who
You mean, do we have time, Andre? We always have time.
For those who are trying to link the recent events at the U.S. Capitol with the events that we saw in terms of protest riots, if you will, over the summer, how would you respond to those folks? And then secondly...
Let me just address that very quick. There is absolutely no connection, so no comparison.
Secondly, in terms of cost of the vaccine, for those who are poor and uninsured, and they have questions about the logistics in terms of how they would get the vaccine, the meat and potatoes, if you will.
Sure. I might let Dr. Avula just address that, but I can just assure that nobody will have to incur any expense as we vaccinate Virginia's population. So, Dan, is there anything? Norm? I've been overruled here. All right. Dr. Oliver, welcome.
Danny told me to answer. No out-of-pocket expense to anyone who gets this vaccine. If you have insurance, your insurance can bill for the administrative costs. If you are Medicaid and Medicare, they will pay for the administrative costs. And HHS has a special fund, a provider relief fund, that will pay for those administrative costs for people who are uninsured.
Thank you all very much, and we look forward to being with you again. But in the meantime, stay safe and stay healthy. Thank you.